Hello everyone, welcome to a new video. I have a lot of assignments to do for class and school in general, so I figured I would come on here and film this video really quickly. So this video is why EVS, or environmental services, might be a great way to soft launch yourself into medicine. So this is primarily for those who are interested in nursing or perhaps becoming a doctor or being in the medical field in general, because this role, it kind of allows you to be undercover in a lot of ways in a hospital setting without being directly like in patient care. So let me explain. So I've been in 2 patient care roles before. I've been a patient care tech, but I only lasted like about 2 weeks, and that was about like after 2 or 3 weeks of orientation. So in the theory part of learning, like I enjoyed learning about the medical aspect, the wound care, the phlebotomy. Everything was just really interesting, and I found it really cool. And I think a lot of people who approach medicine who maybe don't have a background in it approach it from that theory aspect of like, in theory it's really cool, it's awesome, you're saving lives, but then when it comes to actually being in a patient's room, having to do practices like cleaning up poop, cleaning blood, seeing blood, all these things, smelling certain smells, it's very overwhelming, it's very gross, and if you're not used to it, you may not last as long as you expect. And that was what happened to me in my last patient care role. I actually, I felt like I was doing all right. I can steel myself, I can kind of just mentally prepare myself for things and just decide that I'm gonna be okay with it. But there was a particular behavioral thing that I saw that I wasn't quite prepared for. So I just didn't feel like it was the right thing for me at the time. Now I'm in a different state. I'm going to be going for a certification for a CNA. So as from that lens, from that output, coming from that aspect of like, okay, I want to become a CNA, I'm actually wanting to pursue nursing very soon, I will be applying in the fall. How is my current role as an EVS worker, a hospital custodian, if you will, how does that prepare me for that role? So the number one thing, probably the most obvious thing, is that you're going to see very gross things as a custodian. I am a housekeeper. I am in charge of cleaning rooms. I'm an evening role person, so I mainly don't interact with patients except for like the average housekeeping things that maybe I might be called to clean up a spill, clean up vomit, clean up pee, anything that happens while the patient is there. But overall, I clean up the room after the fact during discharges of patients or transfers of patients. So needless to say, I've definitely seen a lot. I've been in several departments over the past 4 months. I've been in the ED, I've been in labor and delivery, and so I've seen kind of like the output that people can have, even not just cleaning the rooms, but cleaning like the bathrooms, cleaning the lobbies, and just also with that, being able to see certain behaviors, be able to observe without being in directly a part or participating. And I think that's really helpful because especially with the ED, being able to, I'm not actively watching patients, oh my God, looking into rooms or anything, but sometimes I pass by, sometimes I might just see and observe things. I'm a pretty observant person already, so, I'm hearing certain things, I'm seeing certain behaviors, I'm kind of noticing if it's not interfering with my job, I'm kind of noticing how it's being, how nurses and CNAs are reacting to things and what they're doing and what I might not want to do myself. And that's really helpful. You're kind of able to observe from the sidelines without being directly involved, and I think that's a really helpful perspective to see. And yes, on top of that, you are seeing the gross outputs, the gross things. You're not necessarily actively cleaning the patient, for example, but you do see the poop maybe that's left behind, or You have to smell a lot of stuff. You might be cleaning up blood, you might be cleaning up, various liquids and fluids. And if you're not comfortable with that from a custodian output, you're not going to be comfortable with it in a patient care setting. And so I value it because I feel like it's kind of desensitizing me to things that maybe a few years ago when I was in that patient care role would have been gross to me or unnerving to me. But like now I'm constantly exposed to it, and it doesn't bother me as much, right? And even in the aspects where I'm like actually talking to patients, I am able to kind of test myself. I consider myself a pretty introverted person, but I don't overly talk to patients, especially depending on their situation or their condition, but I do try to make sure to be kind, to be understanding. Like for example, the other day I had to clean up a urinal spill. If you're not aware, the urinals are like the little plastic jugs that they give to male patients to pee into, and this gentleman had used it, and the way our beds are set up, it's to hook it onto the bed, you have to put it on a very specific way, and he wasn't able to do that, and it spilled, it fell, and he was like profusely apologizing, and I'm like, it's totally fine, it's totally normal, it's my job, I don't really mind. And just humbling. I think being in that position really keeps you humble in a way, and it's not to like look down upon the role, because it is an important role. We are quite essential in the ability for patients to be coming in and out of the hospital, because we're cleaning the rooms, like we're making it safe for the next patient to come in. So we are an integral part of the hospital, like the way it runs. But just remembering to be humble and remembering to treat the patients in a way that's kind and not demeaning them. And I think even that is very critical and very important for someone who wants to be in a patient care role. You never want to try to make it the person's fault, for being where they are, because it's not necessarily their fault. And I am not a harsh person by nature, so I wasn't going to be like rude about it. But again, it kind of is a test of your character and a test of your patience. And with that particular instance, after I cleaned up the spill, I also got him a new urinal because I had thrown out the other one. I didn't really think of like it was lying in pee. I wasn't gonna wash it off and give it to him. So I got him a new one. I will also say, having been in my previous patient care role at a different hospital, there are some things that I personally would do because I was trained to at my last hospital that I would do if I were to get a CNA role either at my current hospital or another facility. And that doesn't directly tie into this, but I don't know, there are things that I notice because I'm a custodian that I would do as a CNA, if that makes sense. So for example, in rooms where there are 2 patients instead of 1, I personally would actively label every single thing in that room per patient, especially that was what I was trained to do at my last hospital, but mainly because when we are cleaning as custodians, it's very easy to just start throwing everything away, right? And there's one sink for the whole room. So a lot of times I find myself not wanting to touch certain things because I'm not sure who it belongs to. And so you might have things left over that belong to a previous patient, and now it's still there because there's no clear indication of whose it is, right? Not everything is necessarily put on one side of the room or another. The other thing is just cleaning up as a CNA. There are certain things that our CNAs don't do. Some CNAs don't do. Some CNAs do clean up the room, strip the beds, do things that help us as custodians to get things done faster. And therefore, as someone who is to clean up these rooms, I know that as a CNA, what I would want to do to make it easier for the custodian. There are, oftentimes many things left over that simply shouldn't be, whether it's listed as like their role or not, it really shouldn't be left. There's often identifying markers from the patients that shouldn't be there, that should have been discarded safely. There are often equipment left over. There's often IV bags that are full of medications. Medications are also left in the room, which the nurses themselves should be taking out of the room. So I'm able to see that from this perspective. Okay, what am I supposed to do as a nurse or a CNA before leaving the patient's room for good? And so I kind of have that outlook of like, okay, this is what I'm going to do. I'm going to clean up after the patient, or make it like, make sure these specific things aren't in the room after the patient has left. And of course, patient belongings always have to be taken out. Medications should be taken out. There's just things that I'm noticing as a custodian that I think now prepares me for when I'm a CNA to know how to manage things, if that makes sense. I did write notes, so I'm just checking to see. I did have a kind of list of all the roles of an EVS person, but I can make another video specifically about my role as an EVS housekeeper, like what we're expected to do in case people are interested in applying as an EVS person. But some additional skills that I think, in addition to everything I've added. So that's also the use of the system. So it depends on your hospital, of course, but my particular hospital uses Epic. Now, again, background, I have been trained in Epic. I know how to navigate it. However, if you were coming into this as your first role and you're, not necessarily from a patient care perspective, you're not going to be able to see patient information. But the way that we use Epic as a task orienter, kind of to see our rooms and to log what rooms we're doing, log our breaks, etc. But there's other things that we can kind of look into as maintenance people, which kind of helps me kind of understand how Epic works, how Epic can be used in other ways. And it just, I don't know, I find it very interesting and easy to learn to navigate Epic in different ways. So you might find that as like an extra tip of like, you're not directly related to patient care, but you can kind of begin to navigate Epic for your benefit so you can understand how to use it later on. And then I just had a list of skills learned. This is really from like the perspective of, if I were applying to nursing school right now, I do plan on getting more patient care experience because I need it for my application. However, if I was applying to nursing school and this was the only role I had used, how would I like talk it up to make it like clear that this is valuable experience? So I've learned skills like time management, learning to prioritize and manage tasks as well, prioritization, organization, and patience. Those are all very significant elements of nursing, being a CNA, being a patient care technician, being in patient care in general. And to go into it a little bit, also a little more background, I've been in plenty of management roles prior to this. This isn't a management role, and these are all tasks I've already learned, I've already mastered, I've already used in various different jobs. However, in this specific job with time management, we are timed on the rooms that we do. We are supposed to finish a room within about 45 minutes. Some rooms take longer than others. Like if we're doing an OR, cleaning an OR, it takes longer because there's more mess, more blood. Labor and delivery rooms as well specifically take a long time depending on how messy the delivery was or how much equipment was used for that particular delivery. So that often takes a long time. But you learn how to implement systems that allow you to clean the room quickly and effectively and get it ready for the next patient in time. And you learn how to pace yourself appropriately. Prioritization and task management. That goes line in line with the time management, but learning what to do first, especially when a room is marked as stat or a patient is incoming. You learn how to you should learn how to like clean quicker or prioritize certain tasks first so that if a patient does need to come in sooner, which should never happen, you should always have the appropriate amount of time to clean the room properly and sanitize and disinfect everything properly before the next patient comes in, because that violates patient safety. However, for example, in the ED, you don't clean a room for 45 minutes. That's just not allowed. Plus, the rooms are smaller. So after like several instances where maybe I was cleaning, I clean in a certain way for larger rooms, but in an ED, the beds need, like, the turnover is quick. For my particular hospital, we didn't get called for every single room. It was only for infectious rooms that have like isolation rooms where you have to go in with a gown. Those were the rooms we were called to clean. So for those particular rooms, and especially if there was patients due to come in, I made sure that I would start with the bed first. I would clean the bed, which really is the priority for any room you clean. Besides stripping the room, getting rid of all the trash and the linens, that was first priority. Second priority was cleaning the bed and making sure the bed was ready. And then cleaning the floor is also a priority, versus maybe like organizing the wires and cleaning the equipment down, which is still important, but you know, trying to do the things that take the longest first, or that eliminate the most of the mess first, rather than the small things, the little tiny things. The organization, learning to organize a room properly, learning to organize yourself, your carts, making sure that everything that you need is on your carts, making sure that you're able to just organize in your mind as well what you're doing step by step. Like sometimes, especially for me, I don't know if I have ADHD, I'm not diagnosed, but sometimes I can get very overwhelmed when I walk into a space and there's a lot of mess. Now, ironically, my apartment is messy most of the time, but there's like a organized chaos in my head where I can like compartmentalize it and not care. But when I walk into a room and there's like clumps of messes in every space, then I have to start to like understand, okay, what am I doing first? Because if I'm not careful, I'm gonna start doing one thing and then get off track and try to do another thing, and it's just too overstimulating for me. So learning to organize yourself, learning to organize your thoughts, and create a plan very quickly in order to, you know, get this room done as quickly as possible. I think all of the things I've mentioned so far are pretty critical for like a nurse or a CNA, especially when it comes to like what kind of patient do you see first in a list of patients that have differing symptoms. Who do you see first? Who do you prioritize, right? When you're going into a room and someone maybe has multiple different complaints, what are you addressing first? So I think all of those kind of allow your mindset to improve, and allows you to think in terms of priority. I already think that way because of, again, previous roles I've had, but it's a very good way to kind of train your brain to think quickly and create systems that work effectively. Task management, patience. So, I think there can be times, depending on the day, depending on my mood, I will walk into a room that might be particularly dirty. There might be things left over, like meal trays and IVs, and it's both overstimulating and frustrating. And it's very easy to allow your frustration to affect the way that you do things, or maybe you're like banging things around more than often. I don't particularly do this, but you become either flustered or you start just being erratic, right? And a lot of times I've had to like calm myself down, especially when it's the first room of the day and it's just like, this is a mess, this is terrible, why would they do this, why would they leave it like this? And it's like very important to learn how to like literally calm yourself down as quickly as possible, take a breath, and just start doing something. So these might be a little bit of a stretch, but it's like skills that I see that have been implemented and are applicable to this role. And I think that, once again, going back to my main point, if you are someone who wants to enter the medical field, if you are at least 18, I believe, and you have the capacity to enter a EVS role, it is kind of dominated by more older people, but again, as coming from the standpoint I find it valuable, both because I get a lot of like little bits of wisdom from different people, and yeah, it's not like a high stress job necessarily. It can be very overwhelming with the number of rooms you can get on a very busy day, but I think it's a really good way to be able to observe medical procedure, observe like patient interaction, observe, you know, the gross things without being directly involved. And if you can handle being a custodian, I think it might be a bit of a stretch, but if you have interpersonal skills and you can talk to patients and you've already kind of maybe dealt with customer service or something, and you go into this role and you're learning, you're just observing, right? And you're doing a good job. You're seeing different things that are left over in different units, and it also is a good way to help you understand, like, okay, maybe I might like this unit better. Like, I'm going into it expecting that I want to do labor and delivery specifically because I have an interest in women's health, but there are different floors I've been on, like the ICU or the SCU, a special care unit, intensive care and special care. They're on the same floor, and you know, maybe not the patient care part, you know, I don't know too much about that, but this might be a little funny, but how these particular departments are organized and behind the scenes. So like the way their nourishment rooms are organized, the way their medication rooms are organized, how calm things are at the nurse's station. I'm observing all these things for myself to understand, okay, maybe I might want to be or want to try this specific specialty first, or I might want to give this a try. The CNA program that I'm now applying to, which hopefully should be in like May, June, they actually allow you to enter their facility, and it's more of a retirement home, senior adult care, and it's more like geriatrics, something I wouldn't have considered whatsoever, but you know, if that's the way that kind of the universe is bringing me, and I'll be able to see more than what I see at a hospital, or I'll be able to see things in a different way and apply that to my knowledge base. So this is going a bit longer than I expected, but I just wanted to share how an EVS position might be a great way to kind of soft launch into medicine and see things from a different perspective before directly interacting with patients in a patient care setting. So I hope this was helpful for someone, and please let me know what your thoughts in the comments, and I'll see you in the next video.